So when are we actually going to get to cardiac rhythm strip interpretation? Well, if this describes what you're thinking at this point, then this video is for you. So the graphic that you see on the screen here, this graphic provides an overview of the cardiac cycle, which is a fancy term that describes the events that are composing a single heartbeat. Okay, so this includes the preparation for the next beat or cycle. Now, each wave and segment has a name and event associated with it. Every event in the cardiac cycle also has a normal range, and each is going to be occurring in fractions of a second. And what's important to understand is that each cardiac cycle should produce a pulse. For example, if you palpate a radial pulse on your patient, you should feel a rebound for each R wave in the cycle. The R wave is representing ventricular systole, so we'll talk a little bit more about it in just a few minutes here. But each R wave should produce a palpable pulse. If a cardiac cycle occurs and a pulse is not felt, then it's likely that that beat did not perfuse adequately. So this is often easy to identify when you're taking a manual blood pressure, for example. So if a patient has frequent premature ventricular contractions, which we'll talk about later, you'll often hear a pause with each of these PVCs on auscultation. So this is because PVCs may or may not eject enough blood volume for adequate perfusion, and it's also the danger associated with something like ventricular tachycardia. Now, each measurement and segment are going to play an important role in cardiac rhythm interpretation. So in order to recognize what's abnormal, we have to know what the normal cycle looks like first in its textbook form. Okay? So from these intervals, we can then build on the foundation and cover the most common and some uncommon telemetry rhythms that we're going to come across. So rhythm interpretation is one of the most challenging topics for new nurses, paramedics, and medical residents as well, but it doesn't have to be. In the upcoming slides, we'll take a look at each component of the cardiac cycle in more detail. But for now, the take-home points on this slide are, number one, that the cardiac cycle represents a single heartbeat. Number two, each cardiac cycle should produce a palpable pulse. And number three, if a cardiac cycle occurs and a pulse is not felt, it's likely that that beat did not perfuse adequately. So let's look at the P wave. We've covered positive deflections on the ECG and what they actually mean. We're going to go ahead and dig into the cardiac cycle now and examine the first positive deflection, the P wave. P wave is the first of the party. It's the first deflection in the cardiac cycle, represented as the PQRST, and it represents SA node as well as atrial depolarization. Now, the single most important lesson that I can impart to you right now is that the P wave represents atrial depolarization and contraction, and the QRS complex is going to represent ventricular depolarization and contraction. This is important because the SA node is what we refer to as the pacemaker of the heart. It quite literally sets the pace for the timing of each cardiac cycle. Now, all P waves should be upright, and they should all look the same, relative to a specific patient anyway. So my P wave may look different than yours, and your P wave might look different than your sister's or your mom's. But what's important is that your P waves all look the same, and that they arrive 60 to 100 times per minute. Now, if a P wave appears that looks different than the rest, we refer to this as an atrial ectopic beat. Ectopic is simply meaning that it's from an abnormal origin. If an atrial beat comes early, we call it a premature atrial contraction, or PAC. Premature atrial contractions are typically benign, but they may be felt as occasional palpitations in some patients, for example.